When you showed me videos of before and after of what you'd achieved with some of your clients, astounded wasn't the word, because that looked as though they'd been injected with a special drug, and then you tell me that's after just one session. So what is it that, what are we uncorking here that you do that's so special?
Well, as far as, I wouldn't say that I specifically have some magic drug or some magic sequence of events or some magic knowledge that isn't out there for the world to see. I think what's different about what I do is, number one, I think that starting with listening to where people are at is a huge component of medicine that's missed, unfortunately. And so my first session with people is an hour and a half. Oftentimes I go 2 hours with people, and I ask them about everything in their life having to do with Parkinson's and not. Where are they emotionally? Where are they physically? What are they hoping to achieve? What do they think is realistic? What are their fears? What are their biggest fears about the future? Or, what is their environment like? Do they have a social support system? And I think that medicine has gotten away from listening because of a whole host of reasons. Practitioners typically don't have the time to sit down with people and get to know you one-on-one. And because, at least in the States, our medical system is incredibly burdened from a time perspective. So physicians especially, and even physical therapists now, are expected to get people in and out as quickly as possible, give them the best option that they can come up with in 7 minutes, or as a physical therapist, having to see 2 or 3 people at a time to make sure that you can meet the demand. And so the way I've set up my practice is to help eliminate that rush. People can't get better if they're rushed through that process. So I listen, and I try not to force people into things that they're not ready for.